my name is Sam, and I'm a physiotherapist who specializes in resolving pelvic floor dysfunction. So pelvic floor dysfunction, or PFD for short, can refer to any issue involving the pelvic floor muscles. This can include urinary leakage or urinary urgency. It could be sexual dysfunction, so pain with intercourse, erectile dysfunction, difficulty orgasming. It can refer to prolapse, where the pelvic organs actually fall down, sometimes outside of the body. It can also be bowel leakage or constipation, or even pelvic pain. Pelvic pain could be anything that's in the joints of the pelvis, so around the SIJ, the lower back, or the pubic bone at the front, as well as any pain around the perineum, the anus, the vagina, or the scrotum and testes for men. Commonly thought of just a problem for the pregnant and the elderly, pelvic floor dysfunction actually affects young men and women, and even teenagers. In fact, statistics show that up to 80% of all men and women will experience some type of pelvic floor dysfunction in their lifetime. Why is pelvic floor dysfunction increasing? Evidence is pointing to too much sitting, lack of squatting, lack of walking, and a very sedentary lifestyle that we are leading in these modern times. However, the good news is that by understanding how your pelvic floor muscles work and why we are having so many problems, it is possible to resolve these issues and even prevent them as well. Let's start by looking at some of the anatomy. Here is a model of a female pelvis as it would be located just here. First, you can see the bony structures. So we have the crests of the hip on either side. We have the pubic bone and the pubic symphysis right at the front. And then as we turn it around, we can see the lumbar spine, the sacrum, and then the tailbone, all located right here at the back. So lumbar, sacrum, and then tailbone. The pelvic floor muscles therefore run from the tailbone at the back right around to the pubic bone at the front to form this three-dimensional bowl-like structure, which helps to support all of the pelvic and internal organs, as well as stabilize the bony structures, namely the pubic symphysis and the pubic joints, as well as the sacroiliac or SI joints at the back. If we turn the pelvis now up a little, and keeping in mind this is a female pelvis, we can look at the three different openings in this one. We have the urethra, closest to the front, the vagina, and then the anus. And then of course in men, we would have the penis and scrotum, and then the anus at the back. In both men and women, the muscles of the pelvic floor all around here help to provide closure to these structures in order to maintain control of both bladder and bowel, maintain an erection, achieve an orgasm, and support all of the pelvic organs. Most patients that I see with pelvic floor dysfunction not only have weak muscles, but actually too much tightness and tension in those muscles. This can result in decreased blood flow to the area, which limits the ability to achieve an orgasm or maintain an erection, and it can also decrease nerve function, leading to sensory problems, creating painful sensations, and also decreasing motor control. Therefore, the most commonly prescribed exercise for pelvic floor dysfunction, Kegels, or repetitive contractions or tightening of the pelvic floor muscles, can actually increase the tightness in these muscles and make the problem worse. The good news is, by decreasing the pelvic floor tension and increasing the mobility of the bony pelvis, you can use whole body movement and exercises to train the muscles to work in coordination with the surrounding structures. This will result in improved blood flow, nerve conduction, and overall function of the pelvic floor muscles. It is important to know that the muscles of the pelvic floor do not work in isolation. Instead, they are just one piece of the entire pelvic web. Starting with the glutes around the back, which help to stabilize the sacrum, and even the piriformis, which most people associate with hip pain. However, it is one continuous structure joined with the fascia to the pelvic floor muscles, as it forms the back wall of this internal pelvis. In addition, the diaphragm contributes to gentle movement of the pelvis, of the pelvic floor muscles, with every breath in and out. And all of the muscles that attach to the pelvis and the sacrum will also affect how well the pelvic floor can function, namely the groin muscles, everything around the thigh and the hip, the lower back, and the abdominal core. This is why exercise programs focusing only on Kegels fail, because as you can see, Kegels will not address the rest of the pelvic web, which is so important for pelvic floor health. It is really exciting that by taking into account the fact that the pelvic floor is just one part of the entire kinetic web, we can build a holistic program to naturally resolve many pelvic floor issues and pain. No one should have to put up with embarrassing bowel and bladder problems or crippling pain, and everybody should be able to experience pain-free and exciting sex. Should be able to experience pain-free and exciting sex.